Okay, welcome back, everyone. So we're going to start with a new presentation. Tejasvi and Garima are going to do it. So Tejasvi is our executive committee member, and she's a fantastic researcher. So she's going to introduce herself and take it over. Good luck, Tejasvi.
Thank you so much, Dr. Mansuri. And thank you everyone for attending today's session. I would like to introduce Garima before myself. She's just give me 1 second. There's like some issue with my presentation. Give me 1 second. Thank you so much for waiting. So Dr. Garima Yadav and myself, we are international medical graduates from India. And we are thoroughly invested in psychiatry, and we are participating, both of us, in psychiatry residency match in this cycle. Dr. Yadav, she's currently working as a research scholar at International Psychiatry Scholars Collaboration. She's actively involved in multiple psychiatry-related research projects and holds numerous publications and presentations across national and international platforms. Myself, again, I'm Tejasvi Kant. I'm currently working as a research scholar at Manhattan Psychiatric Center, and I'm involved in conducting trials as a clinical trial coordinator for patients with schizophrenia. I'm also actively building frameworks to diagnose Alzheimer's disease at an early stage using neuroimaging and AI at Stony Brook University. All right. So let me start presenting the topic. And the topic of discussion for this one would be how to submit your papers. So please let me know if you can see my screen.
Yes.
All right. So what next? So congratulations, first of all. Now you have an idea, you have a team, and hopefully my colleagues have thoroughly kind of explained to you how to conduct research and how to start with an idea and get things done. You have done all the work. Now what's next? First of all, let's talk about what do you need to do before you even start drafting. Once you have an idea, before you start a first draft, what you and your team needs to do. The questions to consider before starting the first draft is, what kind of research am I looking at? Is it an original research, like a cross-sectional study or an observational study, which at our level, a medical student level, that's something that we can easily do in our hospitals. Is it a letter to editor? Now, if it is a letter to editor, it is very important for us to contact journal editors prior to drafting it, because if once you draft a letter to editor, only in that journal, I mean, it can only be accepted in that journal for that specific research article. So this is what you need to do, like before even you start your first draft or talk to your team about letter to editor. For review articles, you look for the journals that you are interested in, and you look if there's a call for paper. Basically, all the journals, they have calls for specific articles. For example, like recently there was a call for in mental health, in psychiatry. So the articles were looking for research in COVID and depression, like when the COVID hit. These days it's more going on towards like opioid pandemic. So again, I mean, this is a great way to kind of look at the timelines, and to look at how easily you can kind of get your research published. And if you don't get any call of papers in your interest topic, you ask attendings that if they are invited to submit a paper on a specific topic of interest, and then you might be able to like find something that's useful. Also look for timelines and deadlines for abstract submissions in medical conferences. So every research study you can submit as an abstract, and that abstract could eventually lead you to present a poster or an oral presentation at local conferences. And you can also submit the same research as a finalized draft to a journal where it can be published and cited. And we have been talking about that since morning. If you're looking at US residency, submitting as an abstract is the easiest way to build contacts and collaborative collaborative groups through those meetings, and you meet mentors and you meet applicants that are interested in the same specialty. So you can form a group and then go on to publish more in that specific subject. So now while you're drafting, what can you do to make sure you are submitting into the right journal, or your kind of topic gets accepted later on? Now, if you have a target journal, gauge the writing style of that journal. If you have done all your work before you started, this is what you need to do. You need to like take up the target journal and read 3 to 5 papers from the same journal on your topic of interest. You'll kind of get to know the writing style, and also the more you read, the better your writing will become. So that is very important to kind of gauge how well drafted the papers are in that journal of interest. Now, if you don't have a target journal and you have completed like your first draft of paper, what can you do now? You look at your reference list. So in your first draft, you would have cited studies and you have a reference list. Now, sometimes citations from one specific journal, they come again and again in that reference list. So that kind of usually tells me, okay, that's the journal I want to target, that's coming up again and again in my reference list. So go to that journal. You can email their editors if they would be accepting your review article or whatever kind of article is, and then you can proceed with the submission. Now, after you have a draft ready, what can you do? Congratulations again. I mean, finishing a research project is time consuming and energy consuming work. By now, you should have a detailed literature search with you, and you should have list of certain suitable journals for the topic of interest. Journals usually favor original research. By original research means, this kind of evidence has not been there yet in the literature. For example, it's a cross-sectional study or it's an observational study. Except case reports and case series, most of the original research is favored by the journals. Followed by meta-analysis, because it's a combination of multiple studies and it's quantitative evidence for that specific topic of interest. And then again, systematic review, so where you are systematically reviewing all the papers and you have kind of detailed prisma charts and you have the methodology together. So that would be a qualitative review of all the studies that you have done. And later on comes case series, and then case reports and letters, and henceforth. Now, submission is more about organization and timely communication than it is about writing. The writing part has already been done. And once you have list of target journals, start with your top priority journal. Go to their website, and every website has an instruction to authors. For example, this is the link I will show you after this slide. We can go through, one specific journal and how these instructions for authors are listed. And then in these instruction of authors, you are given everything: word limit, what kind of citation style they want, what is their figure and table limit, and how do they want you to submit these figures and tables. Is it a separate document, or is it kind of embedded within the same file? And other specific details about, those minuscule things. You want to like read your paper multiple times and, get it through multiple eyes. So every author should be kind of reading your final draft so that there are no errors in grammar. Everything is kind of sorted. A nice tip to organize all the drafts is, once you have the first draft ready, after every iteration, write the number down. So if you have done your first draft, this would be the second iteration. Name it as draft 2. I would name it as TK, Tejasvi, my initial, and then date, so that your team knows who has iterated it, and so that multiple drafts are not getting mixed up, while you're reviewing it multiple times. And then your team can create multiple drafts. For example, if Garima reviews after me, then we can write a TK dot Garima dot, whoever has reviewed it later on. This methodology comes in handy when working and guiding your team. Let's go through the paper. For example, there is a submission guidelines. For example, I took up nature.com. I mean, that's the most common journal, I like to study. I mean, usually we'll be submitting to something, that's like low on index, but that's a good kind of submission guideline to review. They have everything together there. So they will kind of give you all the guidelines before you submit, submission guidelines, then ready to submit post publication. And then we don't really need these details, but they will tell you the format, the abstract. Then for manuscript, they'll tell you the word limit, cover letter. Sometimes they usually have samples on Google, revised manuscript. And then they would, I mean, if you need editing services, some journals provide that as well. But usually we don't really need it. I mean, that's usually covered in whatever the open access fee or fee for the journal is. Again, references would have their own list, like what kind of references they want. Is that APA, MLA? There are different kind of references. We will go over that in our next slides. So again, I mean, there will be multiple journals, and every journal has this submission guideline link attached to it. Coming back to our presentation. Okay. One can see my slides, right? Okay. So after submission, now that you are done with major submission, what's next? It's time to wait. You can reach out to editors in 4 to 6 weeks after the day of submission. And the emails to reach out are usually listed on every journal's website. For abstracts, you usually have a set day that is set by the conferences as to when you will have the decision back, or whether your abstract has been accepted or not accepted. If it is accepted, then it can be accepted as a poster or an oral presentation from whatever you chose while submitting the abstract. I would invite Garima to present the draft of the poster and kind of get you through step-by-step methodology to draft an abstract, a poster.
Thank you so much, Tejasvi. So now that we have reached a final stage and, we have on the way to submitting an article, one of the most important things are poster presentations. So poster presentations are like very small, and, you can do multiple of them. Like if you have your studies, you can pick up snippets out of your study, which are different, and you can submit it to different conferences if you like. So like I can share with you 1 second. In this is a poster which was recently submitted to the AMA. And as you can see, for a poster, we basically need a few of the headings, which are very important. Will be a background. Like you have to give like few words, what your entire study was about, what is the background, why are you doing it. The second thing will be the case presentation. Like this was a clinical vignette. So we will not have the methods and the results part. So what was the case that you were talking about? And if you have taken any important pictures, anything that you can include in your poster. For discussion, you can tell what was the important thing, correlation that you had in your study with the case, and you can discuss it in a few words. And the last conclusion topic, you just have to tell in snippets, like what are you taking from this entire clinical case scenario? Like what was it about? What are you getting out of it? And how can you do it better? And then the references. So this is a small way you can present any poster, but this poster is specifically on a clinical case study. But if we have to go for an original research where you have done a systemic review, or if you've done a meta-analysis, the changes which will be present will be, you'll still have the background, but instead of a case presentation, you will go about your aim of your study. You will write about what is the method, what is the results. So those will be 2 topics which you'll end up adding here. And then again, the discussion, how did your methods and result correlate with your study and, with the other studies. In few words, you will write the same thing again in the discussion. And then the conclusion, like what is the takeaway from the entire thing. So the difference between when you're writing an article and a poster is posters have to be very concise. And so this is a virtual poster. So like for AMA this time, like when we submitted, because that's a recent conference, they had a virtual poster where you can just write your poster like this and submit it, or you can record yourself, make a video of yourself presenting your poster, and you can put it. So those are the different ways that you can work on a poster. And while submitting an abstract, generally every conference which you're submitting will have the specific guidelines and word limits. And the most important topic, like when you're submitting the abstract, which you'll be touching on, will be the background again. like in 2-3 lines, you just have to tell what is the background. In the case presentation, you have to tell like in 4-5 lines what your case is about and the conclusion, and you submit it. Once it gets selected, then you come to this final part of drafting your poster. Thank you. I'm handing it over to Tejasvi.
Thank you so much, Garima. Another thing I want to add to the poster presentation is like, that's my personal experience when I went for APA during once upon a time. So when you have a date for poster presentation and you are going for a conference, always have a poster with you, either printed or you know, before time, at least 1 or 2 weeks before you order it to be printed at a local FedEx site or wherever, so that, you know, once you are in the meeting, you are not thinking about where you are going to get it printed. And sometimes there are so many people getting their posters printed, there can be a delay. So I mean, that would be something, you know, once your posters get accepted, before presenting, make sure you kind of have that handy, your poster handy. Now let's move on to the next part of it. So peer review and revision. So we have already talked about the poster. You present your posters. You have also presented the same study as a draft, like you're submitting as a paper for a journal. Now for journals, if your draft meets all the criteria that we reviewed listed in the instructions, you will be invited for a revision. And most likely that will be around 4 to 6 week timeline. Again, if you don't hear back from the editors by then, email them again. Now during submission, the journal asks for 2 to 5 reviewers with subject specific knowledge to review your article. Either they will ask you to give the email addresses and names during submission, or they will have their internal reviewers reviewing your submission. And then you will be sent instructions to review either via email or in the submission portal. So some journals, they have a submission portal, and they have a way to kind of communicate with authors in the same portal, or they can do both the things. Every revision needs to be tracked. So when you go on your Word document, there's an option to track changes. So whenever you are revising it for the journal, you need to track it, and then you need to send that tracked changes document to the editors, along with, you know, if you want to accept the track changes, that's fine too, but you need that track changes draft in your revision submission, so that they can review only the revisions and they don't have to go through your article again. Now, what are the resources or what are the skill sets you need to kind of submit it? So everyone has their first time. So first submission is always like the most difficult and most daunting one. But the resources that come in handy are, again, for drafting, you can use Google Documents if you are working with the team simultaneously, and MS Word if you are the only one kind of drafting and redrafting your paper. For citation management, the paper pile is free of cost. It's an add-on on Google Document. And then the EndNote is another software that's a paid software. And that can be used on Word document as well. It can be installed in your computer. For tables and figures, usually PowerPoint, Excel, and Google Sheets is good. If you kind of need tables in the Excel, Google Sheets is a good one, because like the system will kind of, the Google AI would generate whatever kind of charts you want, either bar diagram or, you know, it has an option to auto generate your tables and figures. Another one is Canva for pictorial kind of infographics if you want to use it. Another skill is time management and organization. Like we discussed, it goes a long way in submitting and getting your work published, because there are multiple peer members that are, you know, working on your drafts, and also mentors. So you need to be careful of their times and time zones. And last but not least, the patience. Your research will go through multiple iterations and submissions. So be patient. Sometimes it even takes 6 to 8 months to get your work published. Which is fine. Again, you know, you want your best work to be published. You don't want like your kind of first draft and like very basic draft to be on the internet for everyone to review. So tips and tricks: a mentor with domain specific knowledge and experience goes a long way. This mentor can again, work hand in hand with you, and eventually, when it comes the time that you are applying for your residency, this mentor can actually guide you to, apply into the specific programs, or your research, your papers will help, and also the skills that you develop while you build that relationship with the mentor. That is very important in residency application. Always note down the deadlines in your calendar. So for example, you have call to author, or you have a submission deadline for an abstract. Always note it down in your calendar and submit at least 2 days before the deadline. And why I say that you submit at least 2 days before the deadline, because these journals and conferences, they have paperwork and disclosures for all authors to fill out. And if the authors are in different timelines, it can take more than 24 hours for you to even finish that kind of submission. It's not like you started and then within an hour you are finishing. It might take more time, because those authors, they might be on a different time zone, or they might be sleeping. So you want to make sure you're submitting at least 2 days before the deadline, for you to be stress free throughout. And then I guess that's the end of my slide. I hope this session was useful for you. I look forward to answering your questions and comments. Thank you.
Thank you, Tejasvi. That was very insightful. So let's take up some questions now. So one of my questions would be, like, anybody who's approaching like the research for the first time, they have working with somebody. So what suggestions would you give them, like when they're writing the first draft, like if they're writing their introduction for the first time, like, so how should they go about it? Like what the first 1-2 paragraphs of the introduction should be all about?
So I actually like FDA and WHO. Those are the two websites I refer to, and that's to kind of give readers an idea of how grave the situation is, like for whatever specific disease. For example, if I'm reviewing, let's say, diabetes, or association of diabetes, let's say, with depression. I don't know if there's something, but it's an idea. So I would actually look up WHO, FDA, and kind of statistics about how many people are affected with diabetes and depression, and then what's the kind of current scenario, and then which genders are affected. So kind of give them factual information and to kind of get their interest into the paper. And then towards the end, I would kind of gauge, go from interest to what other people are doing, and then to what why we are writing this on this topic, like what has been done so far and what hasn't been done so far, and discussing what we are going to do with our paper and how it can help. So sort of that kind of summarizes a usual introduction. Feel free to pitch in, if you have other ideas too. I know you're great at writing too.
Thank you, Tejasvi. That was very insightful. So one of the other things I would like to add about the introduction is, like she said, you always have to give the data. What are the statistics? What is happening regarding the topic? And then in the second paragraph, probably you can go ahead and describe what that topic is all about. And the third paragraph, you can give a simple, why are you doing it? Like, why is it important and why are you doing it? And then just write in 2 lines what you're trying to describe in the study, like what the main aim of your studies is. Just tell that in 2 lines in the last paragraph. So it should be very short and sweet, like the introduction. Yeah. And Tejasvi, the next question which we have in the chat box is, can't I do a research alone and submit to a journal? And can I do entire systemic reviews by myself?
Theoretically you can. I have seen papers with one authors, but again, to do some valuable research, you want to have multiple authors, and kind of from the same domain. So they will add a different kind of picture to your research. And also probably, journals like it. When they see a senior author, that's the author at the end of your list, kind of who is domain specific and who is, for example, an attending or a program director. That definitely is important for journals to know that you are working with kind of mentors who are knowing the Okay, thank you so much for muting the person. So there's also a question for a retrospective descriptive study. Can we present the conclusion or part of conclusion as a separate abstract for a poster presentation?
I would like to take that question.
Sure.
I think it depends on what kind of study you're doing. So if it's an original article and you have different, like if you have a entire big data set and you have divided it into different parts, then probably you can. Because you cannot submit the same thing to different conferences and then go submit it. There has to be a variation in what you're doing. So if that entire paper, you can have two variations, then you can submit it as an abstract or like a poster to another conference.
Yeah, I
Jessica?
could kind of, go ahead and describe one of my experiences. I conducted an observational study in India where I was kind of, using a AI-based questionnaire to diagnose dementia at an early stage. So what we did was we kind of in one poster, like as one abstract, I submitted it as a methodology and kind of, the result. So how many patients were diagnosed with early MCI, late MCI, or Alzheimer's disease. And in the second abstract, I actually studied the comorbidities of the patients that were diagnosed, and we realized that people who had three or more than three comorbidities and were at a higher risk to develop dementia from the same study. So you can do that because those informations and those observations are different. So it can go as two separate submissions. But if it's the same submission, I don't think we can kind of separate out the conclusion part from the methodology, right? If that kind of makes sense, Garima.
Yeah, thank you, Tejasvi. So one thing I would like to add, recently I did a paper and it was original research in which I compared depression in adult depression and its relation to adult onset asthma and childhood onset asthma. So that was a huge manuscript from the database we worked on. And in that, so one of two abstracts which I could get from that manuscript, which I recently submitted, one was, it was on the social demographic status and its correlation with depression in the kids and adults. That's one I got. And the other was just comparing adult onset asthma with childhood onset asthma. So it is like, if it is a huge manuscript like this, you can divide the abstracts. So Tejasvi, our next question, which we have is, does the content of the cover letter matter?
Yeah, it matters to a certain extent, as in, it should be very crisp. Again, you will direct it to the editor, and if you have the name to the journal, and then you'll draft it like a letter with the subject. And what should matter is why you are writing the article. Like the aim should be very crisp there, the heading should be there, and also it's also good to kind of write down which author was doing what in the letter. So it should be specific but crisp. And yeah, it matters.
So then, thank you, Tejasvi, for that answer. So another question that we're having is sometimes, what about the manuscripts? Do they need to be indexed in PubMed? Or you can just publish it in journals which are not indexed in PubMed? Like, what is the importance?
So if a journal is, if a article is indexed in PubMed, it's easier for everyone to review it. For me, like as a residency applicant, the better my content is, kind of reviewable or watchable, the better it is for, myself and my team. That, and also, it has more chances to get cited. But other than that, if this is your first submission, any journal is fine for this first submission, as long as you know that you have worked hard on paper, and whatever you're doing is basically systematic and the way it needs to be done.
Thank you, Tejasvi. Another question which we are having is how to write a manuscript. So I would like to take that up first. So before you start writing any manuscript, you always need to have it in your head. What are you going to talk about in this research? What is the aim? Your aim always needs to be clear. The research question which you're working on needs to be clear, because if that is not clear, the rest of the manuscript will not follow. So first, you always formulate a research question. You end up writing the criteria on which you are going to do this study, and what your inclusion criteria are, your exclusion criteria are, and then you go from there. Tejasvi?
Yeah. I think having a plan before you actually start writing a manuscript is most important. And also, I would kind of advise you to reach out to a mentor before you even start writing it up. Mentors can really help you kind of analyze your question, because as early phase clinicians, we are not really aware of we don't have a greater understanding of what needs to be done clinically, like what are patients needs, what is a physician in the same, like for example psychiatry, looking for, right? What kind of literature is needed right now. So mentors can actually like help you guide through that process. And again, like Garima said, we need to have like the plan, the inclusion exclusion criteria, and everything there. Another article, another question I was kind of reviewing was, so how do we recognize predatory journal? I believe Dr. Nicola covered it, but again, I mean, predatory journals, sometimes you will have websites that look a little off. And also these journals will say that they are located in some place, and they would have like a Gmail account or a phone number associated with another country. That is one way to kind of look at predatory journals, but I would actually go to my local library. So if you are a medical student, you can always go to a medical school. If you are observing, you can always go to the place you are observing at. But even the local librarians, like every city has a local library, you can always go there and ask them. They would have like a list of journals that are kind of predatory. So you can always do that, and it's good to reach out to seniors always.
Thank you,
Garima, would
Tejasvi.
you like to add something into it?
No, I completely agree with Tejasvi. It is always important, like before doing any research or anything that you're doing, if you have a mentor, please reach out to them. It's always ask for help. Whenever you ask for help, you'll always get it. So please go out, ask your seniors, ask your professors, and just ask them for help. It'll help you in the end, because you'll have a answer. They've seen more world than you, and they're more experienced in this. So thank you, Tejasvi. It was very thoughtful. So one of the questions that people are asking is, if you have 10 publications in Curious, do those publications matter? So I would like to start with that. See, when you're starting out your publications, right, all of us have to start somewhere. So 1, 2 publications, 3 publications, if you're writing and you're publishing it in Curious, that's good. But what I would like to say is, don't publish all your, manuscripts in one journal. You need to diversify, because otherwise when you look at a CV, it will not look good. If you have 10 publications and all 10 are in Curious, so you need to diversify, like 3 are in Curious, 1 can go in PMC in different journals. So I think that would be more helpful for you. Tejasvi?
Yeah, I agree. I mean, even Curious, any other journal, like the first 2, 3 publications is okay in Curious, but after that, I would ask you to diversify. Even your experience will change. Like, for example, I have actually like talked to editors of different journals. So your experience working with different people changes, and like you get to know, you have a better idea basically. If you have like a draft with you, you can gauge in a better way if that will be accepted or not, if you try to talk to multiple journals and editors. So I mean, again, after like first 3, 4 publications in Curious, I would go on to other journals except Curious.
Thank you, Tejasvi. So another question for you is, how do they come to know which are the low impact factor journals, so they can target it and, submit the research there?
So I would actually like, I have a different opinion on this question. I would not target my paper in a low index journal. I would actually target it with the research question that I am asking. So some journals have calls for paper, and some journals kind of accept a specific kind of paper. And if my paper matches to their question they are asking, I would go ahead with that. But again, I mean, the index of the journal, you can always Google it, and it's on the website, like what kind of index it is. And then you can gauge, uh, there's another question, like, can I directly get published in JAMA, which is like, again, we know a high impact factor journal, without a known senior author, if I have done good work? So theoretically, yes. Practically, no. Because theoretically, yeah, you can submit. But again, I mean, the journal looks at the content and also like the overall picture of the study. um, if you have, like, again, as a student, I'm looking at it the way, if I'm not adding a senior author or a mentor to my paper, my paper wouldn't be of the quality that it would be, if a senior author or a mentor was there in the paper, if they were guiding through the paper. So again, yes, you can submit it. Is there a highly likelihood of getting into the into something like JAMA? Maybe not. Garima, I mean, do you have any words of advice for this specific question?
No, I actually agree with Tejasvi. I think it's not about JAMA itself. It's about whenever you're writing any manuscript and submitting any research to any journal, it's always better to have a senior author in it, because it's a credibility which also matters in the end. Like, you are starting out, they don't know you. You can, if you have somebody who's already there, the chances of it getting published becomes more, because there is somebody who's already been publishing for so many years. The credibility is there. So it does not have to be somebody, if you're in a med school student, you have a professor, they might have published. So you go to them, tell them this is the research you've done, tell them to have a look over what you've done, and will they be able to help you in it. And I don't think they're going to say no if you've actually done good work. They would like to help you out. So if it'll be better if you could add somebody. So Tejasvi, the next question which we have is how to search for journals that publish on specific topics. Is there any site, how do you find out, about that?
Usually I use like a specific terminology on Google, call for papers, and then you put in, whatever specific, for example, if I am interested in psychiatry, I will put in psychiatry, and then it will generate like specific links, right? And then go on to those links and see. Another way I do it is, we are all together right now in research, in this meeting, and we will formulate a group there. You can always ask out your peers and your mentors if they know a journal that is asking for a specific call of papers or a specific topic. And usually, like, people are helpful. If I go with the intention that I will get my answer, I usually get my answer. So that's that has been my technique so far, and it's working. I'm not sure, like, Garima, do you kind of agree, or do you have something?
No, I completely agree with you. Whenever even I have to search for any paper submission, I just Google it. And I think Google is one of the best ways to answer majority of our question these days, like to have it there. So just type in the right keywords and just go ahead and, and search, you will find your answer there. And sometimes in your colleges, in people, just tell them that you're working on some paper on specific topics. If they have any email, anybody reaching out to them, any journal, they should just forward it to you. So it's always better to ask other people also. You never know, when something falls in your lap that way. Okay, next question that we have is how to do a research without joining a research position officially. So I would like to take that answer. So the thing with research is you don't have to be in an official position or be working somewhere, because it's not always available. You can't always go to a place and start working. So, but what you can do is you can form a group of like-minded people who want to do research in those specific topics, and then take a topic and have a mentor who can guide you. And then you can start working on research like that. Research, it doesn't have to be in an institution. You can start doing it with a group of people and then make it a bigger group. And if you have a mentor who's guiding you, you can publish a lot of publications. And I have done some of my publications that way, all thanks to Dr. Mansuri. So it is not always important to be in an official research position, Tejasvi?
I would like to take up that question because I have experience of both. I have experience publishing, from home, and also I'm like part of institutional research as well. So from a residency kind of perspective, I think having those groups to kind of do research from home is very important, because that is getting you, into the right mindset of publishing, writing more, producing work, which you can actually like put up as, a set of publications on your CV. For institutional research is like, for example, a clinical trial. It runs for on an average at least 2 years for them to publish some kind of results. And again, I mean, as a clinical care coordinator, you are actively involved with the patient, but not so much at a higher level where, you are doing the analysis or the writing part. So chances for you to get a publication out of that is lesser than if you do research from home. So that, yeah, again, I mean, you can definitely do research from home if answering very specifically, and get more out of it rather than joining a university or an institution.
Thank you, Tejasvi. That was very insightful. So, another question that we have is, does research done in home country matter, or it has to be specifically in the United States? What are your thoughts?
I think it matters more because, I mean, for example, for IMG specifically, we have licenses to practice in our countries, and we can actually do original study, original research in our countries. And in United States, usually we will have data sets, and we can still do the original research, but it would be secondary resource, right? So I think it matters more because our, like, for example, I belong from India, and then there are countries, they are not really represented in the literature, right? And we want patient representation in the literature that we read, and it's like more important to conduct that kind of research in the country from origin. And again, I mean, like I said, I conducted that study in India, but I published it in Alzheimer's Association International Conference, which was conducted in San Diego, United States. So you can do research anywhere and submit anywhere, as long as you are able to uh, put it forward in your interviews and make collaborations and like-minded contacts.
Thank you, Tejasvi. One point that I would like to add to it, I think research in general adds to your CV. It generally adds to your profile. So if you're in med school and you want to do research, go ahead. Start working on it, start submitting your stuff, try to target, like back in India, we have like, you'll have the small conferences, go submit your research in that, try to publish, and then go and aim for higher journals. And when you come to the United States and you have chances of working with people here, go ahead and again do it. So it's about starting somewhere. So wherever you're able to start, just start. It's the steps you keep taking, the small steps in the right direction, which matter in the end.
Yeah.
So
yeah, I have another question. Research LOR versus clinical LOR for community programs as the fourth LOR if you have strong research. What are your thoughts about that, Garima?
okay, I would like to say, so this is something I've recently done with my CV. My 3 of my LORs were clinical and 1 was research. So I think it was not about community programs or university program. I feel if you are able to submit a specialty specific LOR and you can submit 4 LORs, I think it is better if you make 3 of them clinical and 1 research oriented, so that any program that you're applying to, they will know that your clinical skills are good as well as your research skills. It talks about your complete profile. It's not only that you're a good clinician and you don't have anything, you've not done in research. If you have done research and you have somebody who can write an LOR for you, why not? It just becomes like a better view of your profile. So that's my viewpoint. What about it, Tejasvi?
Yeah, I mean, same here again. If you have 3 clinical letters, 1 research letter, research is one of, again, core competency that residency programs look for. And academic programs, usually they have a team of research team tagged along with them, like they can actually like ask that team to, do those biostatistics. But if you are someone pursuing community residency hospitals, they want clinical work from you. But again, if you have like a lot of research on your profile, that is looked at very favorably. And you want to have different kind of letters kind of bringing out different sides of you in the entire application. That's kind of my 2 words for that.
Thank you, Tejasvi.
Yeah.
So one of the other questions that we have is it about the number or quality of research or both? So I would like to take that first. So I think both hold important value. You have to publish something which is good, and the quantity also matters, because if you're looking to match into a residency and you're working on some project from last 1 year and still it is not getting published, it's not going anywhere, you cannot put it in your CV. So in the end, all that work does not show up when you finally need it. So when you're doing this big researches and it is going to take time, do take time, but start doing small works also, so that, you have publications in your CV when it is needed. So that's my point. Quality is important, but along with quantity also, you need some quantity to it. What about you, Tejasvi?
Yeah, like I remember Ishan and Annie kind of, telling in the group that it doesn't take much to publish, extra 3-4 hours a week. I think you can do great if that's like very focused and you have a great team to work with you. Research is actually like, once you know what to do and where you can get those skills from, it's very easy to kind of squeeze in with your observerships and with your other like more kind of clinical research scenario. So yeah, I mean, it really both matter, but right now for residency application, I think number is more important. Once you have the number, you can definitely work on the quality, but everything goes hand in hand. So initially you want to produce more, and then eventually your quality will improve because you have done so much work at getting those number of publications.
Thank you, Tejasvi. Now, this is specifically, could you please tell everyone like how to add the citations, through the paper pile? Because I think we're getting that, like how to actually work on the references. And if you could show it to everyone, it
So
would be very
I can
nice.
show it. Yeah, I kind of did it with one of my my research groups. So I can bring about my Google document again. This wasn't planned, so I can go for Google Docs. I'm just going for blank document here. And let's say I want to, write something here, and then I'll put references here. For example, just like, I don't know if there's any association, but let's just go for that diabetes.
No, there is association.
Okay, that solves our problem. So what usually happens is there's a paper pile. So if you Google paper pile, right, you will get that, and paper pile for Google Documents. And this is like a free thing. You can always add that if you start paper pile. I mean, right now it's saying 30 days. Sorry about I live near a hospital. So start paper pile, and you can actually add is an extension to your Google document. So it's an add-on. So if you see in my extensions, it's listed here, manage citations. This dialog box will come out. So for example, if I want to, and I'm bringing out a topic here, let's say this one. Okay, I will take this heading, go to my Google Doc, and then search. And it, I mean, usually brings up a list of papers. So, I mean, right now, I think if it's in there, it will bring up that paper, that specific paper. For example, it's bringing up some other thing, but if I add all the authors and everything, the complete citation, it will bring up that specific article. So you just cite it here. It will add to it. And then, whatever, if every journal has a different kind of citation style, you can choose it and then update citations. And once you do that step, your references will be added in a separate list towards the end. So the references has come here. I mean, I hope this answers your question. And again, like if, for example, you don't have a journal in your mind, you can always update everything. So if I have multiple citations here, I can always choose a citation style and update citations and bibliography, and everything will be updated all at once. Like we don't have to do that manual kind of iteration, which takes time and which is like, it needs a lot of patience. And I have done that too. So this has worked with me. And then I control all and copy everything into Word document, and like everything is seamless after this. Any questions about it?
Thank you, Tejasvi. That was like really insightful. And I hope it helped people, because sometimes references can be such a problem, in the end.
Yeah.
So yeah. So one of the questions that we have here is, what about a strong research letter from a PhD without MD versus a moderately strong research letter from an MD? Like, how does it matter?
This again, I mean, I think content of letter is always important. If you have a moderately strong letter, it also depends on the time that you have worked and what kind of role that you have played. If you were part of the team but not leading something, then I would use a letter where you were leading a project and you had an important internal role in kind of formulating questions with the PhD rather than MD. I think it will all depend on the content of the letter, like what you have done specifically, and then how involved were you, and for how long that research was. But again, I mean, I probably don't know the specifics of this answer. I'll know once once we get through the match. So on to you.
Thank you, Tejasvi. And I agree with her, we don't know much about it, but what we heard from mentors and what people have told us, and the sessions that we have attended, what we have understood is always the content of the letter that matters. So the amount of time you have spent with your mentor, the person who's writing you the letter, and how they write it, what you have done it and how they bring it about is actually more important, I think. So we cannot be sure that what we are asking is correct because we're still in the process ourselves.
Yeah.
But yeah. So one of the questions we have is again, can they match into Ivy League program if they have 50 plus publications at Tejasvi?
So this is all about like once we match we can kind of let you know what this is. I think there's always theoretically a chance for you to match into Ivy Leagues. It will all depend on like the complete picture, not just research. Research is like one small component of your application. It'll be your scores, it'll be your clinical skills that you have gathered, what kind of letters you have, and how strong your letters are, who are your mentors. So again, I mean, I think research, like having 50 publications, that's like, okay, that's one data point, but what are the other data points for us to kind of give the answer to that question, if that makes sense?
Yeah, I actually agree with Tejasvi. I think it's not, research is a part of your profile in your CV. If every one of us filled out the ERA, there are many other things which matter. So it's the entire profile which needs to match into, I think, not an Ivy League to any program. Your entire profile has to be good. It's just not the publications, and the research does add to your profile. When they interview you, they'll definitely look, you have 50 publications, and of course, but you should be able to talk about those 50 publications.
Yeah.
That's why. And the other things are very important too.
I agree. I mean, there's two steps. So once you have crossed that filter, you have like 3-4 publications in your CV. You have crossed that research filter. After that, it becomes okay. What's your number, and what's like how many publications you have in that specific domain where you are applying, and how complete your application is overall, rather than like the number of publications. So if I have like, for example, 20 publications in 5 different specialties, I don't think that will get me very far in matching. But if I have everything aligned in one specialty, I have a good chance. I mean, that's how I see it. And Dr. Mansuri, he's been kind of mentoring me, and mentoring all of us in that way. Any other questions, Garima?
No, I think we're done for the day.
Any last
Thank you so much.
Advice for us and students?
I think the only advice that I can give everyone is that, it does not matter in the end, if the first time you're publishing or the 10th time, you need to start somewhere. So start small. It's in the end, what I was told, it's always your small steps, in the right direction, which matter. So just keep taking those steps, no matter, what anybody else says, that it might work out or might not work out for you. Just keep working in the right direction, even it's just baby steps, and you will reach your goal. So don't give up and keep trying, all of us are in the same boat. So, we have created this community, thanks to Dr. Mansuri. So, we can all interact and you can make your group of friends and you can start doing your research by your own, So take advantage of that and reach out to people, ask for help,
Yeah.
There is nothing wrong in asking for that. We're all learning and we'll always learn, and medical profession is all about that. Tejasvi?
Great. And thank you so much, Karima. I mean, that's like so real. But yeah, again, for research specifically, I think patience and organization goes a long way. If you are organized and you have all your drafts like in folders, that will be a lot less headache for you if you do it, from the beginning. And also patience. So again, to publish, we know it's like, we think like it's a big mountain to climb. But again, small steps get you there. You won't even realize it, once you develop that kind of great team. So yeah, all the best, and let us know if we can help you in any way. So keep in touch through groups and through email.